Hi everyone, welcome to Vibrant Living. I'm Dr. Lisa Lanzara-Bazzani. As a mother of 2 home-birth daughters, I've always wanted to share the benefits of midwife-assisted birthing with my community. The manner in which a baby is born and the manner in which a woman becomes a mother truly matters. The position a woman gives birth in and her trusting her own body and connecting with it, in my opinion, can result in a non-stressful birth for the baby and for the mother. So today we're going to explore how birthing marries science with art and time, and how children can benefit from chiropractic care before they are born by having a mother who receives prenatal chiropractic checkups. Today's guest is Rebecca Keller, certified nurse midwife and advanced practice registered nurse. Rebecca is affiliated with Full Circle Midwifery Care in Nashua. Welcome, Rebecca.
Thank you.
Thank you so much for being here today. And I should mention that you have 3 children of your own, and you had 2 home births, correct?
Yes, I tried the first time, but I needed transfer to the hospital, and I was transferred, and everything turned out well. But I needed medical care, and he's fine.
Excellent, excellent. So let's start a little bit with the term midwifery. Can you explain to our audience a little bit about what the term means and a little history that goes with it?
Sure. Midwifery, the translation basically is with woman, and there are many different types of midwives and many different ways to be trained as a midwife, but basically the idea is that you care for women. As a certified nurse midwife, I do births. I care for women during the prenatal time and through birth and postpartum. And I also do basic gynecology and routine exams. Other types of midwives that there are in Massachusetts, in New Hampshire and Massachusetts, you can be a certified midwife, and that would be somebody who was trained in midwifery but doesn't have a nursing degree. And there are different paths to follow to go into midwifery. It just depends exactly what you're looking for. I chose nurse midwifery because it's legal in all 50 states, and it was an entry that didn't limit me at all. I happen to practice in a hospital, and as a nurse midwife, there generally isn't too much difficulty doing that. And so that's why I chose that route, but I honestly went in through the nursing as a means to an end so that I could go anywhere in the country and practice and not have to worry about restrictions. New Hampshire is a very midwife-friendly state, no matter what your entry level is, and practice it's a great state to practice in for all different types of midwives. So it's a good place to be.
Good. So what piqued your interest to be a midwife in the first place?
Most people who go into midwifery will tell you that they were called, and I will definitely say that that was the case for me. I come from a very medical family, and so I had a lot of exposure to different types of things. I actually have an ancestor who was a midwife in the South, a granny midwife in the South. And I struggled as a young woman with what I wanted to do with my life. And one day I was talking to actually a nurse practitioner, and she said, "Have you thought about this?" And it was like a light went off, like, oh, this is what I was meant to do. And most midwives, if you talk to them, they'll say there was some moment in time when they were like, oh, this is what I was put here to do.
Right, their aha moment.
Exactly. And it is, I will say, it's a very demanding profession. And it definitely is something that I would I think you need to be called to do, because it can be consuming.
And rewarding.
Yes, at
Absolutely.
the same time.
Absolutely. Now, I really love the term full circle midwifery,
Mm-hmm.
the center, the care center that you're affiliated with. Can you explain a little bit to everyone about full circle?
I didn't come up with the name. It
preceded you.
It precedes my practice. I can talk a little bit about the woman who started the practice at St. Joe's. Her name is Barbara Watrous, and she actually used to be at Southern New Hampshire, affiliated with the Lamprey Health Center, which used to be Neighborhood Health years ago. And she actually came over to St. Joe's and started Full Circle there. So I'm not sure how they came up with the name, but we do.
So full circle meaning that you encompass like adolescent health,
yes, the
through
whole
menopause,
lifespan.
And you also incorporate gynecological, you couldn't take that out.
Gynecological
services, exactly.
Yes.
So explain to us a little bit about, how the age group that you're dealing with at the practice and how it carries through womanhood.
Okay. My youngest patient is about 11. We do a lot of work. We get people women come to us from the pediatrician, or young girls who are having problems with their periods, with pain or dysmenorrhea. So we do a lot of that. Obviously, through young adulthood and the childbearing years, we take care of people during that period of time. We do pap smears, we do screening for STDs, and then later on, dealing with menopause, women who are struggling through menopause or need some assistance going through menopause. My oldest patient is 82. So I really enjoy that. Obviously, I love to deliver babies, but I also love taking care of women outside of that, and really being able to take care of the whole woman, not just that time.
Right.
Childbearing for most of us is not a very long period of time, so it's nice to see people throughout their lifespan. One of the greatest things of being here for the past 6.5 years is that there are some women now who I saw as teens who are now coming into their 20s and thinking about pregnancy or have had babies, and it's just wonderful to you feel like you really get to know people.
And you're part of them on their journey.
Yeah.
And being there to be helpful.
Yes, that's probably one of the things I enjoy most.
So how many births roughly have you assisted in since you've been with Full Circle?
Oh, with Full Circle?
Or in general?
I could probably figure it out with Full Circle, because I've been here about 6 years, and we do between 100 and 120 births a year, and there's 3 of us.
Okay.
So with a little math.
Yeah, exactly. Well, good. Well, you've definitely helped out quite a few babies enter the world.
Yes.
So a lot of women are talking about different alternative positions to give birth in. Can you share with everyone maybe a little bit about, the positions that you feel are advantageous to an easy birth, so to speak? Maybe a little bit about water birthing. Do you do that as well, or assist with water births at all?
We don't, at St. Joseph's Hospital, we don't do underwater birth. Okay. However, we do have a tub room, and I actually very strongly encourage women to spend some time during their labor, if that's something that appeals to them, because it doesn't appeal to everybody,
right.
To spend some time in the tub. Oftentimes you'll hear people call the tub the midwife's epidural. It really does help with labor. It helps with progress. Oftentimes when women are in active labor and they stall out, or they feel like, oh, I just can't take it, I need to do something, I need something, oftentimes I'll say, let's go try to hang out in the tub for a while. And sometimes people progress really rapidly, and I'm not above draining the tub and jumping in, so I'm
You're right there.
I didn't do an underwater birth, but it was a tub birth.
Excellent.
So I think water is very helpful. Also, some people like to be in the shower.
Right.
We have I don't know what the right word would be, like the detachable shower head. And a lot of women just like to sit in the shower and just having the water running on their bellies when they're having contractions. That feels very good. As far as positions for delivering, never flat on your back.
Excellent.
Physiologically, that makes things more difficult.
Absolutely.
Because the pelvis is more compressed and it makes it much harder for the baby to negotiate the pelvis. So you can do what I call a American lady squat or Western lady squat, because most of us don't spend time over a pot stirring. So our muscles here are not developed as they might be for somebody who spent a lot of time in a squatting position. So oftentimes we'll do a modified squat where someone's sitting up and pulling their legs back, but their butt is still on the bed. And that helps to keep the pelvis open. One of my personal favorites, because I think it decreases on perineal trauma, so tears to the perineum.
Yes, I wanted to ask you about that. Do you massage the perineum with any oils or?
Yeah, I like arnica oil. That's my favorite, but you could use olive oil too.
Yes.
But side-lying delivery on the side, in a side-lying position, I find the least amount of tearing. That's probably, if somebody asked me, okay, what can I do so that I don't have a lot of tearing, I would say deliver on your side, because for some reason that tends to have less trauma to that area.
Okay.
I encourage people, if they're interested in trying to decrease that, they or their partners can do perineal massage leading up to delivery. That's helpful as well. Most people, if left to their own devices, they'll get in a position that's comfortable for them. And different people like different things. And the important thing, I think, for us as midwives is we're there to educate and to assist, but ultimately the woman is the one who's delivering the baby. And so whatever works for her, we learn to accommodate.
Okay, so when the actual birth is actually occurring, you will accommodate their position that they innately choose to deliver in.
Right.
Okay.
And obviously we'll make suggestions,
right,
especially if we feel like things are hung up and you just need to change the diameter of the pelvis a little bit for the baby to get their head underneath the pubic bone. Sometimes just a change of angle will assist with that, and sometimes just a little change of position sometimes will be the trick.
Okay, and we actually, through the care center, have received some patients with regards to breech positions. And a lot of times in chiropractic, when we have a mother that comes in with a breech baby and wanting us to turn a baby, we're not actually turning a baby, but we're actually adjusting with a diversified technique the sacroiliac joints to allow more space and the right amount of space in harmony and balance. And we correct the misalignment so that the baby has enough room to turn.
Right.
So tell us a little bit about some of the breech positions that you're seeing that will affect a birth and what you would do with regards to that.
Okay. Breech presentation occurs, I wouldn't say frequently, but occasionally. We don't worry too much about breech presentation until people are well into their third trimester. And we're always checking position. It's a little bit difficult to do with your hands prior to 28 weeks. But after that point, when you come in for a prenatal visit, we may not say that we're doing that, but we are checking position. If you're getting close to term and the baby remains breech, there are a few options. We encourage people to seek chiropractic care because of the technique that you mentioned.
Correct, the Webster technique.
Right, the Webster technique.
Yes.
And that's very helpful for having the baby turn on their own.
Right.
It's also, I would also mention that can be helpful for, even if the baby doesn't turn on their own, we do something called a version. It's actually the physicians do it with our assistants. And what they do is basically turn the baby from the outside.
Manually.
Yes.
Yes.
And it really is turning.
Right.
It's a pretty dramatic procedure and not too much fun for the mom, but I would think much better than having to have a C-section.
Exactly, exactly. And a lot of times too, if a baby is breech, and a mom I think has tried, either the Webster technique through our chiropractic office or tried a version, sometimes it's for the baby's own good that it doesn't turn because perhaps the cord may be short and there might not be enough room, and thus, the child would be injured.
Right.
Right.
Sometimes there are no explanations and you don't find out the reason even when you do the C-section.
Yeah.
Other times you find out that there's some sort of anatomical abnormality in the uterus that may have caused the baby to be breech and to stay breech and not turn.
Right, right.
There's lots of different reasons. There definitely, and I don't know if there's any research, but I can tell you in my 14 years of practice, there's a definite genetic component. If somebody tells me that their mother had a breech baby, that's
Ding,
a
ding.
red flag, for us to make sure that this baby is not, the grand baby is not breech as well. We don't, as a general rule, do vaginal breech deliveries. It's risky. I'll tell you that I have done it. Not because it was part of the plan, but sometimes things happen and you do end up having to do that. So you really need to know how to do that, but it's not really the best way or the most low-risk way to go about things.
Okay. Now, do you use manual extraction when you're delivering? You're guiding the baby with the shoulders and the head to come out. Is there any pulling at all, or do you ever use, there's no forceps obviously that's involved, or do you occasionally use them?
I'm very blessed to work with a wonderful team of doctors, and a couple of the doctors are highly trained and highly skilled in using forceps, and there's a time and a place that it's called for, and forceps is a kind of a dying art because it's not taught in most residency programs. So it's unusual to have somebody who's very skilled at it, because there really is an art to using forceps. And sometimes it's necessary. And for some women, forceps is preventing a C-section. And if you really, really don't want to have a C-section and we need to turn the baby to get the baby in a position so that you can deliver vaginally, or, for whatever reason we need to use forceps, in many instances that we're doing it to avoid a C-section.
Okay.
So for a lot of people, that's the lesser of two evils, so to speak. It just depends on the situation. Some people are completely not interested in that and they would rather have a C-section. And again, this is about the woman having the baby. It's not about what I would do. It's about what's going to work for her.
Exactly. So from a chiropractic perspective, with regards to birthing, as far as forceps delivery or, manual extraction that's forceful, or vacuum extraction even, what we do recognize is that the tiny little vertebrae, the little bones in the baby's neck, can get misaligned. And when we're young girls and we're holding our little sister or little brother that's just newborn, and our moms always sat us down on the chair and said, be careful when you hold the baby, hold the head up, be very careful with the head. But yet sometimes in standard procedures, there's manual extraction, forceful vacuum extraction, or forceps delivery. And again, that misaligns the tiny bones in the baby's neck. And that goes most of the time undetected, because a lot of people aren't aware that they really need to have their newborns checked after birth, and the mom be checked as well, so that the baby grows up with a healthy nervous system. So when those tiny little bones that get, basically moved out of their normal position during birth stay that way, they put pressure on the spinal nerves that exit up in the neck area, for example. And that produces a misalignment called the subluxation. And the longer that's left there and uncorrected, the baby will continue to grow, but will continue to grow perhaps with issues or symptoms. The baby could start, developing colic or ear infections, or, different things with a label on it so that it can be treated. When what we do is we'll focus on checking the child, the nervous system when the child's first born, to make sure that there isn't any subluxation, there isn't any misalignment, so that beautiful new baby can enter the world with a healthy nervous system. So, That's one of our key goals too. A lot of chiropractors check newborns in hospitals, or shortly thereafter. The moms will stop by the office on the way home, to have the baby checked, and say, Dr. Lisa, could you just check my baby? I just want to make sure that there's no subluxation. The birth was a little traumatic.
Right.
It wasn't too bad, but just the same, we want to get the baby checked to avoid any future things down the road, which is so smart. So
Right.
smart of new moms to do for their babies.
Right.
So let's talk a little bit about breastfeeding.
Okay.
How does that work in your practice? Do you have another practitioner that will go in to speak with the mom, or with regards to breastfeeding, or do you do that yourself? Or
We do a lot of, we talk a lot about breastfeeding before delivery.
Okay.
And St. Joe's is actually a baby-friendly hospital. That's a World Health designation, and they had to work pretty hard to get that. All the nurses on the postpartum floor have training. We have a full-time lactation consultant who's available not only in the 2 days that you're there postpartum, but afterwards. Sometimes people end up seeing her for months afterwards.
Right.
So there's plenty of resources available to women. The three of us, the three midwives in my practice, we all breastfed all our babies, so we have a lot of personal experience. And we've seen a lot of different things that have come through, different issues that women have had with breastfeeding. As a general rule, I tell people the biggest barrier to not being successful with breastfeeding is not having support in your wider family, and also, not having confidence in your ability to do this. If breastfeeding didn't work, we would have died out a long time ago. They didn't have formula.
Exactly. And you're building up the baby's immune system right from the start.
Right. So we're very supportive of breastfeeding. And if it's something that you want to do, we will make every effort to have you be successful. It's very, very unusual for somebody to really have a problem where they're not making enough milk for a medical reason. It does happen. I have seen that happen. But in the vast majority of cases, if you want to breastfeed your baby, you will be able to breastfeed your baby. We had one woman who had a baby with a cleft palate, and she did tons of research, met with the lactation consultant. She was able to nurse her baby.
Beautiful.
And that was pretty impressive.
Absolutely.
So it can be done, but people need support. People need encouragement. People need to know that there's somebody that they can call when they're having trouble.
Do you recommend a certain amount of time that a mom in your practice would, breastfeed, or is there a minimal amount of time that you recommend?
The American Academy of Pediatrics recommends at least a year. There aren't a lot of women in the United States who breastfeed for a year. That's probably, I wouldn't say, the norm. There are a lot of barriers to that. So many women are not able to do that. Many women have to go back to work at 6 weeks. There isn't really a suitable place to pump. People don't understand. They're like, why don't you pump in the bathroom? Like, would you want to eat in the bathroom? No. So there are a lot of barriers for women to nurse that period of time. And it's only recently that good breast pumps have become available to women. That they can buy and actually keep with them. So I think we're doing better as far as that's concerned, but there are still a lot of barriers.
So does Full Circle Midwifery offer any classes at all with regards to breastfeeding, or?
Our practice doesn't, but St. Joe's does. They have a childbirth class, and they also have a breastfeeding class that's taught by Terry D'Onofrio. She's the lactation consultant there, and I think it's a very valuable class.
Absolutely.
But we do talk about it at the prenatal visits, and sometimes people make it more complicated than it has to be.
And do you think they give up too easily sometimes?
Well, I didn't have a hard time nursing my babies, but I recognize, but for some people, that's not the case. I mean, if you're getting a mastitis, if you have problems with your nipples.
And explain a little bit to everyone about the mastitis.
Mastitis is an infection in the breast. As a general rule, mastitis, there are a lot of things that can cause mastitis. if you get to the point where you do have mastitis, most people need to be treated with antibiotics. Sometimes you can head it off at the pass and not have to go on antibiotics, but if it's not treated or taken care of, it eventually can develop into an abscess, and I've seen that. The big thing about mastitis in the past, they would tell people to stop nursing, which is like the worst possible thing that you can do. If you do have mastitis, you want to continue to empty that breast as much as possible, because that's going to help get the infection out of there. The milk does not hurt the baby. You should continue to feed, you know, the baby from the breast that's infected. It's not going to cause any problems for the baby.
That's excellent.
But I could do a whole show on breastfeeding.
We'll do that we'll definitely do it another time. It's definitely a subject that warrants attention, especially to a lot of young moms who, you know, just may be uncomfortable with the whole idea, not really truly understand the benefits of breastfeeding long term for the baby and for them. The uterus, you know, will shrink through breastfeeding, and you know, everything kind of goes down, you know, and the body just works with its innate intelligence in such a beautiful way.
Oftentimes I'll have women, if I'm having trouble with a tardy placenta, I'll say to women, why don't we put the baby on the breast, because that releases oxytocin. And that's what helps your placenta come out and your uterus shrink down and prevent postpartum hemorrhage and all those things, and that's all from breastfeeding. So, you know, I will say, go ahead, you know, put the baby on the breast and go for it. You know, this is all going to help your recovery. Sometimes we call it, you know, the fourth stage of labor, that postpartum period.
Expelling the placenta.
And just the time after the placenta's out and you're recovering from giving birth. So, and breastfeeding also can help decrease postpartum depression as well.
Absolutely, which is definitely a subject also that needs attention.
We could do a
well.
whole show on that too.
Okay, so I wanted you to share with our viewers a little bit of information on how they can get in touch with you, a website or email or whatever you like to share.
Okay, we are on Facebook. You can like us on Facebook. Just look up Full Circle Midwifery Care in Nashua, New Hampshire. Our office phone is 603-595-3951. We are actually, our office is actually in the medical building adjacent to St. Joseph's Hospital, so you can stop in. We're right across from the CEO's office in Suite 19 in the Medical Arts Building. And, you know, feel free to call the office. We do offer meet and greet appointments for free.
Excellent.
You can call Karen, our receptionist, and she can set up a 15-minute meet and greet, and you can meet with one of the midwives and just hear what we're about and see if it's a good fit for you.
Excellent. Well, thank you, Rebecca, so much for joining us today. It's been full of, you know, great information for our new moms. We thank you all for joining us as well. Remember to live a vibrant life and make your child's life vibrant. Thanks. Bye-bye.